21 Ways to Prevent Heart Disease. Welcome to the Ultimate Wellbeing. Ultimate Wellbeing is a health and well-being channel. The Ultimate Wellbeing channel will help to improve your health and well-being. On this channel, you will see videos promoting good health and well-being that will assist you in improving your health and well-being to ensure your ultimate well-being. If you are new here, make sure to subscribe to our channel to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Relax, have fun as you see our videos and become a better you for your total well-being. Thank you. 21 ways to prevent heart disease are discussed in this video. In this video, you will understand the meaning of heart disease, types of heart disease and 21 tips for preventing heart disease. Now, let us start. What is heart disease? Heart disease refers to several types of conditions that affect the heart. Heart disease is commonly referred to as heart and blood vessel disease. The types of cardiovascular disease include heart failure, arrhythmia and heart valve problems. Heart attack and stroke are related. It is crucial to maintain healthy blood pressure, reduce your overall stress, eat more heart-healthy foods, and get a good night's sleep to prevent the risk for heart disease. Sugary drinks damage our bodies, they cause harm to our hearts and contribute to obesity. For most of us, preventing heart disease depends mainly on our lifestyle, which means there is much in our power to improve our odds of living long and well. Types of heart disease. The heart is a highly complex organ with a challenging role in keeping us alive, so it is no surprise that many diseases affect different parts of the organ in different ways. There are 5 common types of heart disease: congenital heart disease, coronary artery disease, heart arrhythmia, dilated cardiomyopathy, and pulmonary stenosis. Let us discuss these 5 heart diseases. 1. Congenital heart disease. Congenital heart disease is a congenital disability or congenital disability ranging from a small hole in the heart to severe heart defectiveness. Doctors will often diagnose these problems during pregnancy, but you may not experience any symptoms until you reach adulthood. In some cases, you may not experience them. Most coronary artery diseases can be treated with surgery. There are several types of congenital heart diseases, including heart valve defects where some valves are too narrow or closed, bad connections with blood vessels that do not carry blood to the right parts of the body, and there are issues with the heart's muscle itself where it cannot pump as efficiently as it should. 2. Coronary artery disease. Coronary artery disease is a condition that describes the state of arteries when they become too narrow to supply blood and oxygen to the heart. Coronary artery disease often develops due to a buildup of cholesterol, and other waste products from cells, on the artery walls, creating plaque. This plaque can obstruct blood flow and cause debilitating health problems. If the plaque breaks off or ruptures, platelets will cluster around the area to repair the blood vessel. This can easily block the artery and stop blood flow, leading to a heart attack. 3. Heart arrhythmia. Heart arrhythmia develops when the heart cannot regulate electrical impulses that coordinate heartbeats, causing it to beat too fast or too slow. In some cases, heart arrhythmia is harmless and may feel like a minor inconvenience. However, heart arrhythmia may require urgent medical attention if the patient has other diseases that could exacerbate their condition in more severe cases. 4. Dilated cardiomyopathy. This life-threatening condition develops when the left ventricle becomes too enlarged to keep blood flowing. If not treated on time, the heart muscle walls gradually weaken and will not pump effectively. This also causes the kidneys to retain more sodium and fluid, which builds up in the ankles, legs, lungs, feet, and other organs. 5. Pulmonary stenosis. Pulmonary stenosis is a condition that develops when the pulmonary valve becomes too narrow and rigid to support regular blood flow. The right ventricle responds by working harder to eject blood into the pulmonary artery and gradually thickens to compensate for the extra workload. This leads to a condition known as hypertrophy, which does not pose much danger but indicates that it is time for a specialist to intervene. Having discussed the 5 common types of heart disease, now let us proceed to 20 tips for preventing heart disease. 20 ways to prevent heart disease. Here are 20 tips for preventing heart disease. 1. Maintain healthy blood pressure. It is essential to maintain healthy blood pressure because you become at risk for serious health issues once it gets too high. High blood pressure causes damage to your circulatory system and is one of the significant causes of heart attack and stroke. Make sure you exercise, eat healthily, reduce stress, cut down on alcohol, and reduce your sodium intake to lower your blood pressure naturally. 2. Exercise. Exercise is any bodily activity that enhances or maintains physical fitness and overall health and wellness. Exercise refers to any movement that makes your muscles work and requires your body to burn calories. Regular physical activity makes your heart stronger. A stronger heart can pump more blood with less effort. If your heart can work less to pump, the force on your arteries decreases, lowering your blood pressure. This ultimately results in a lower risk of developing heart disease. 3. Get a good night's sleep. According to the National Sleep Foundation, individuals who don't sleep enough are at higher risk for cardiovascular disease. A recent study showed that people who slept fewer than 6 hours per night were about 2 times more likely to have a stroke or heart attack than people who slept 6 to 8 hours per night. Sleep is associated with some risk factors for heart disease, including high blood pressure, stroke, diabetes, heart failure, and sleep disorder is known as sleep apnea. Sleep apnea symptoms include snoring loud enough to disturb your sleep or that of others, sporadic episodes of choking that wake you up several times per night, and excessive daytime sleepiness or fatigue. People with sleep apnea experience multiple pauses of breathing during sleep, resulting in lower quality sleep and decreased oxygen supply to the blood. In addition, sleep apnea can result in a greater risk of high blood pressure, stroke, arrhythmias like atrial fibrillation, and heart failure. If you suspect that you may have sleep apnea, see your doctor about undergoing a sleep test for diagnosis. 4. Stop smoking. As we should already know, smoking cigarettes is extremely hazardous to your health. According to the American Heart Association, it accounts for more than 440,000 of the 2.4 million annual deaths. Smokers have a high risk for developing diseases that include fatty buildups in arteries, several types of cancer, lung problems and atherosclerosis. But quite possibly the highest risk factor, coronary heart disease. 5. Take little aspirin every day. Daily low-dose aspirin is a blood-thinning medicine. The American Heart Association recommends that individuals at high risk of heart attack take daily low-dose aspirin and that heart attack survivors regularly take low-dose aspirin. Low-dose aspirin helps prevent heart attacks and strokes in people at high risk of them. Taking aspirin every day may lower the risk of heart attack and stroke, but daily aspirin therapy is not for everyone. Your doctor may suggest that you take a daily low dose if you have had a stroke or a heart attack to help stop you from having another one. Or if you're at high risk of heart attack, for example, if you have had heart surgery or chest pain caused by heart disease, angina. Only take daily low-dose aspirin if your doctor recommends it. 6. Reduce stress. Managing your stress is crucial to maintaining your overall health. Staying positive, meditating and exercising are great ways to manage your stress and help your heart. Stress can cause a heart attack. Sadly, chronic stress often triggers a cascade of events that cause that final, fatal heart attack. Among its problems, stress increases inflammation, raises your cholesterol and blood sugar, increases blood pressure and even makes your blood more likely to clot. 7. Maintain a healthy weight. Weight loss is a positive lifestyle change that helps lower cholesterol, raise your HDL, and lower triglyceride levels. There are tons of health benefits of weight loss, however, one of the essential benefits is lowering cholesterol levels when it comes down to preventing heart disease. High cholesterol raises your chance of heart attacks and heart disease. The American Heart Association recommends everyone over the age of 20 have his or her cholesterol levels checked every 4 to 6 years, depending on other risk factors, everyday health. 8. Eat fish. Eating fish fights heart disease in several ways. Omega-3s help support your heart. For instance, salmon may help decrease inflammation, prevent clot formation and help you maintain healthy cholesterol and blood pressure levels. The omega-3 fats in fish protect the heart against the development of erratic and cardiac rhythm disturbances. They also lower blood pressure and heart rate, improve blood vessel function, and, at higher doses, lower triglycerides and may ease inflammation. 9. Take supplements. There are quite a few supplements you can take to prevent the risk of heart disease, some of which include fish oil, vitamin D, resveratrol, niacin and aspirin. Combined with a healthy diet and exercise program, supplements can dramatically improve cardiovascular health. 10. Replace sugary drinks with healthier options. Too much sugar can aid in the risk of developing heart disease. Sugar damages your cholesterol and triglycerides, potentially leading to the development of lipid disorder. This can put you at serious risk for a heart attack and stroke. 11. Drink tea. Lowering your risk of heart disease may be as easy as drinking a cup of tea. A study of 40,530 Japanese adults found that participants who drank more than 5 cups of green tea a day had a 26% lower risk of death from a heart attack or stroke and a 16% lower risk of death from all causes than people who drank less than 1 cup of green tea a day. 12. Eat more heart-healthy foods. Certain foods such as salmon, broccoli, nuts and spinach can improve your heart health. Salmon contains omega-3s that protect against heart disease. Broccoli promotes the production of enzymes that helps keep your heart strong. Nuts may reduce the risk of developing blood clots that cause heart attacks. Research indicates that spinach reduces the chance of developing heart disease. 13. Get more fiber into your diet. Got veggies? The American Heart Association, AHA, recommends having a few meatless meals each week and increasing the amount of fiber and whole grains in your diet. This is because most of the cholesterol-raising saturated fat in the American diet comes from animal meat and full-fat dairy products. There are many ways to incorporate more fiber in your diet, including eating whole grains such as oatmeal, barley, quinoa, brown rice, beans, nuts, and fruit. Eating more vegetarian fare may help lower your cholesterol and reduce your risk for heart disease. 14. Consider red wine for heart health. Research indicates the heart health benefits of drinking red wine, but further research is necessary. Some studies have shown that resveratrol, a substance found in red wine, may help decrease inflammation that adversely affects heart health. Red wine also contains antioxidants and may raise levels of HDL, known as the good cholesterol, in the blood. However, other evidence has suggested that, in moderation, alcohol of any kind, such as beer, red or white wine, or hard spirits, may help raise good cholesterol. 15. Limit your sugar intake. The obesity rate in Americans is alarming, contributing to a near epidemic of diabetes, a cardiovascular disease. If you have diabetes, your risk is the same as someone who has already had a heart attack. Abdominal obesity is a significant risk. Portion sizes and the number of sugars in the American diet have dramatically increased over the past few decades. At the same time, the daily amount of exercise has been decreasing. It is good advice to drink slim water, tea, coffee. Use mindfulness when eating and pay attention to the thoughts, feelings and mindless eating cues. 16. Avoid processed and junk foods. Research shows liquid sugar calories become the most significant contributor to obesity, diabetes and heart disease. That includes sodas, juices and diet drinks, which adversely impact sugar and lipid metabolism. Don't be deceived that 100% fruit juice is healthy. Juices are pure, liquid sugar because processing strips away the fruit's fiber. 17. Increase omega-3 fatty acids. Eat anti-inflammatory foods such as cold water fish, including salmon, sardines and herring, flax seeds, and seaweed. Healthy fat benefits your heart by improving your overall cholesterol profile. It also lowers the small, dangerous LDL particles that contribute to heart disease by converting them into light, fluffy, safe LDL particles. 18. Eliminate all hydrogenated fat. Even when the label states no trans fats, the word hydrogenated indicates that the product contains trans fat in one or more ingredients. Hydrogenated fat is in margarine, shortening, processed oils, baked goods, and processed foods like cookies and crackers. Use healthy oils instead like coconut oil, rich in medium-chain triglycerides or MCTs, extra virgin, organic, cold-pressed, olive oil, organic sesame oil and other nut oils. 19. Avoid or reduce alcohol intake. Cut back on drinking alcohol with a drinking diary and stress relief skills. Alcohol can raise triglycerides, contribute to fatty liver and create sugar imbalances. Reducing or eliminating alcohol intake lowers inflammation, contributing to heart disease and nearly every other chronic illness. 20. Lower your blood pressure. Work towards reducing your resting blood pressure to below 120/80. Keeping your blood pressure under control is vital because the higher your blood pressure, the greater your risk of heart attack, stroke, congestive heart failure, kidney disease, impotence, loss of mental function, and dementia. Most people with high blood pressure, also called hypertension, can control their blood pressure without medication by following an appropriate program. Those who still need pills usually require lower dosages and fewer pills. 21. Prevent or control diabetes. Preventing or controlling diabetes could save your heart and life. Heart attacks occur 2 to 4 times more often in people with diabetes than non-diabetics. Strokes occur 2 to 4 times more often. Diabetes can result in several adverse health conditions, including blindness, kidney failure, peripheral artery disease, blockages in the major arteries that feed the legs, erectile dysfunction, diabetic neuropathy, burning pain and loss of feeling in the feet and hands, poor wound healing, gangrene, and amputations. Conclusion. This video has discussed 21 ways to prevent heart disease. The heart is a highly complex organ with a challenging role in keeping us alive, so it is no surprise that many diseases affect different parts of the organ in different ways. Heart disease refers to several types of conditions that affect the heart. Heart disease is also referred to as heart and blood vessel disease. There are 5 common heart disease types: congenital heart disease, coronary artery disease, heart arrhythmia, dilated cardiomyopathy, and pulmonary stenosis. Heart disease is a significant cause of death worldwide, and it is primarily preventable by changing your lifestyle and managing risk factors. I hope this video is beneficial to you. We love to hear from you. Please post your comments below in the comments section. If this video has been educative and beneficial to you, then give it a thumbs up and share it with your friends. Kindly note that the information provided in this video is for educational purposes only. Diagnosis and treatment decisions should be made in consultation with your doctor, general practitioner, GP, dietitians, counselors and relevant professionals. If you are new here, make sure to subscribe to our channel and press the notification button to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Thank you for seeing the Ultimate Wellbeing videos. We love to hear from you. Please post your comments and questions below in the comments section. Also, do not forget to subscribe to our channel, Ultimate Wellbeing Channel, and press the notification button so you can be notified when we upload new videos. Thank you.